Hello, good day, everybody. Um, Thank you all so much for joining us for today's virtual town hall hosted by the Children's Environmental Health Network. I also want to thank the Environmental Defense Fund and the Lead Service Line Replacement Collaborative, and also the National Environmental Health Partnership Council for their support of this series of ours. But today's town hall is EPA's lead and copper rule, what schools and childcare need to know. I'd like to introduce our lead and drinking water town hall series moderator, Nselu Obit Witherspoon. Nsé is the executive director of the Children's Environmental Health Network, where for the past 20 years, she has served as a key spokesperson for children's vulnerabilities and the need for their protection. She is a past member of the NIH Council of Councils, the National Academy of Sciences Environmental Health Sciences Roundtable, and the Science Advisory Board for the Centers for Disease Control and Prevention. Currently, Nsé sits on the External Science Board for the Environmental Influences on Child Health Outcomes of the National Institutes for Health Research Work. She's a co-leader for the Science and Health Initiative of the Cancer-Free Economy Network and a leader in the Lead Service Line Replacement Collaborative. She also co-chairs the National Environmental Health Partnership Council. And she is a board member for the Pesticide Action Network, the Environmental Integrity Project as well, and was appointed to 2 terms to serve on the Maryland Children's Environmental Health Advisory Council. So with that, Nsé, take it away. The floor is yours.
Thank you, Christy. Welcome, everyone. We hope that there wasn't too much drama coming into the webinar. We're really glad to see everyone. And we're going to jump in right here. And I think you're going to enjoy this discussion. It's a quite unique discussion. We have found at the Children's Environmental Health Network and in our child health advocacy work that there's just not enough in our perspective discussion happening and actions related in our learning environments when it comes to lead exposure. So this has been a long incoming discussion that I know we've also heard from previous attendees of our first webinar as well, as far as an interest. Our first speaker will be Lindsay McCormick. She's the program manager for Environmental Defense Fund's health program. And in her role, she supports their efforts to protect public health from toxic chemical exposures by improving chemical policy and practice in the public and private sectors. Before she was at EDF, we knew her very well as she worked at the Environmental Protection Agency's Office of Child Health Protection as an environmental health fellow for the Associations of Schools of Programs of Public Health. And while she was at EPA, she analyzed science and policy related to children's exposures to pesticides, air pollution, toxics, and consumer products and other environmental contaminants. Lindsay's here to provide a helpful backdrop to the lead and copper rule for us as we frame this discussion in learning environments. Our second speaker, and actually just most recent Child Health Advocate Award recipient for the Children's Environmental Health Network last year, is LaTricea Adams, founder and CEO and president of Black Millennials for Flint. LaTricea, she credits her background as an educator with motivating and shaping her community advocacy work. And for 5 years, she taught Spanish to middle and high school students in Nashville, Tennessee, just as a little backdrop, in addition to the other incredible advocacy leadership that she brings to the fold. Black Millennials for Flint, is a grassroots environmental justice and civil rights organization with the purpose of bringing like-minded organizations together to collectively take action and advocate against the crisis of lead exposure, especially when it comes to African-American and Latinx communities throughout the country. She's the immediate past president of the Memphis Urban League, Young Professionals and Thursday Network, and Greater Washington Urban League. Ms. Adams is also the former member of the board of directors for the Memphis Urban League. She's a proud member of the Alpha Kappa Alpha sorority and a terminal doctoral student at the esteemed HBCU Tennessee State University. We're really happy to have LaTricea and helping to frame some of the learning environments discussion here when it comes to the K-12 school environment. And then we also are very pleased to have Carolyn Pakenham, who is the senior manager for water programs at Elevate Energy. She leads Elevate Energy's water safety, affordability, and efficiency incentives, including testing in lead testing, training, and services, and research into water affordability issues in the region. She also oversees her organization's efforts to address water-related issues that increase the cost of operating and maintaining affordable and healthy housing. And Carolyn will also be providing an early learning case example for us in her discussions. So thank you, ladies, so much. And Lindsay, please, the floor is yours.
Great, thank you. Can you hear me?
Yes.
So I was just saying before digging into the lead and copper rule, I wanted to give a brief lay of the land on testing at schools and childcare today. So under the 1991 lead and copper rule, or LCR for short, the vast majority of schools and childcare facilities are not required to have their water tested for lead. And based on EPA's analysis, 127,000 schools and 767,000 licensed childcare facilities are serviced by community water system not required to test. So the only exception to that rule is educational facilities that are themselves considered public water systems because they are, for example, on a private well. And EPA estimates that 8,000 facilities fit into this category, which is only about 1% of the total nationwide. Sorry for the delay. I'm trying to unmute my video, but it's not allowing me to do so. So I'm going to keep going this way. Apologies. So in an effort to reach schools and childcare not covered by the lead and copper rule, EPA has a voluntary testing toolkit called 3 T's for reducing lead in drinking water. But aside from the federal landscape, many states are adopting their own testing requirements, often relying on EPA's voluntary 3 T's toolkit as a guide. So there are now 18 states plus DC that require school lead and water testing, and 11 states requiring testing in childcare. While places where children live, play, and learn are all important to keep safe, EDF has focused in particular on childcare facilities, as we've seen them as a critical gap with several challenges beyond the school context. First, children under the age of 6 are more susceptible to the detrimental impacts of lead, with formula-fed children at the highest risk. Second, there often isn't the same level of facility support and often don't have the same public accountability as schools. And this is even more difficult in the unlicensed childcare environment. And third, small home-based childcares are more likely to have lead service lines, which are the largest source of lead when present, than schools. And this is because lead is so heavy that pipes were typically not made with a diameter greater than 2 inches. So large facilities, such as a big school that require a great amount of water capacity, are unlikely to have lead service lines. So next slide, please. So I want to caveat this presentation of what's in the current revisions for the lead and copper rule by saying that EPA is currently in the process of taking additional input to the Biden administration on the previous administration's final rule. And so this is all comes with a little bit of an asterisk to say that there may be further changes, but we're going to go with what we know for now. So under these revisions of the revised lead and copper rule, for the first time at a federal level, schools and licensed childcare facilities constructed prior to 2014 will have their water tested for lead. Specifically, the water utility would be responsible for compiling a list of schools and licensed childcare that they service and verify the list every 5 years. Then provide each facility with information on the health risks of lead in water, as well as EPA's voluntary 3 T's toolkit as an educational resource. They then would have to test 20% of elementary schools and licensed childcare every year until all facilities are tested within 5 years. And that testing would start in the current 2024 compliance date. And then they also have to offer what's called upon request testing to secondary schools, also starting in 2024, and to elementary schools and childcare facilities following that initial 5-year round of testing. So of note, this is scaled back compared to what was originally proposed, where there was required sampling on an ongoing 5-year cycle at all childcare in all schools. The utility would also need to share the results with the facility no later than 30 days after the receipt, along with remediation options. And then the results would be shared with the local and state health department. Finally, I'll note that states already have testing requirements that are at least as stringent as the proposed testing would be able to receive a waiver to avoid duplicative testing. Next slide, please. So there are a number of key limitations to the proposal that I'd like to highlight. First, the rule proposes a very limited sampling protocol. Specifically, schools would only have a single sample drawn at 5 drinking water outlets, while childcare facilities would only have 2 tested. And so you can see that illustrated in the table on the bottom left of the slide and the specific locations that would be required to be sampled. So this is inconsistent with EPA's own 3Ts guidance, as well as the majority of state requirements, which require testing at all drinking water outlets. And that's really important because lead contamination is extremely localized. So testing at just a few select locations may very well lead to a false sense of security if those particular results are negative, but there are lead sources at other outlets or in the service line. And then second, that sort of transitioning to that next point, another major issue with the schools and childcare testing provisions of the rule is that they do not in any way address the lead service lines. So if a lead service line is present, not only is it the largest source of lead in water, but its presence makes it very challenging to identify the source of lead. And that's because a service line can unpredictably release large particulates of lead that may get stuck in the distribution system or the faucet aerator and lead to sort of these spikes. And the very limited testing protocol required by the rule isn't designed to pinpoint the source of lead if a lead service line is present. So in an ideal situation, what we've advocated for is that lead service lines would be visually inspected for or otherwise identified and removed before testing specific outlets for lead contamination at the fixture. And third, there's no requirement to fix discovered problems. So this is sort of the big elephant in the room here. The proposal doesn't require the water utility or the school or childcare to actually remove the lead sources. So the utility is simply required to present options to the facility, which then it's incumbent upon them to figure out what to do. To further complicate this, the proposal does not establish a lead level or trigger remediation in schools, lead level to trigger remediation in schools and childcare. So you might be familiar with the LCR action level of 15 parts per billion, but that actually is for an entirely separate monitoring protocol and does not apply to schools and childcare. So that means the facility itself is faced with the decision of when and how to take action based on the results they've received from the water utility, and then grapple, of course, with the cost of that decision. So the result might end up being situations like that pictured in the bottom right, where signs are put up informing students not to use a water outlet. And while that's an okay and good temporary solution, it's really not a permanent solution to getting the lead out. Next slide, please. All right, so I'm going to end on a more positive note here to highlight some of the key opportunities for public health community to leverage the new lead and copper rule to get the lead out of schools and childcare. So first, despite all the limitations of the testing that I just went through, it's certainly better than nothing. So we do want to encourage schools and childcare facilities to participate in the utility testing and really begin to explore and understand what lead in drinking water is in their facility. So while utilities are required technically to provide testing through this rule to schools and childcare, they can count a refusal or a non-response from the facility after 2 what are called good faith attempts to contact the facility towards that requirement. So it's really incumbent upon the schools and the childcare facilities to participate. Second, state and local health departments will be receiving a significant amount of lead and water data from utilities through this new rule. So as I mentioned before, that includes the schools and childcare testing results, But it also includes the results from the general monitoring. So that's, houses that exceed 15 parts per billion in the system-wide testing will also have to go, that data will also have to go to the state and local public health departments. And so those departments can really leverage this data in a variety of ways, such as integrating it into their own ongoing lead poisoning investigations. And third, I want to highlight just advocating for prioritization of lead service line replacement at home-based childcare facilities. So there are a lot of factors for utilities to balance when determining how to prioritize locations for lead service line replacement, including factors like cost and efficiency, but it's also really important to keep public health at the forefront, and protecting our most vulnerable children is certainly part of that equation. All right, thank you so much, Ense.
Thank you so much, Lindsay. And again, if there are any questions, please don't hesitate. Use the Q&A little prompt there at the bottom of the toolbar. And we're going to keep on moving and move on now to LaTricea.
Hello, everyone. Thank you so much for having me. What I will be solely focusing on in this segment is around lessons learned and policy as it relates to lead and drinking water in schools. So we can go ahead and go to the next slide. So we'll first start with taking a look at Washington, D.C. So just a little bit of background history and the way in which I, along with Black Millennials for Flint, was very instrumental in this bill. So back in 2016, D.C. students at a myriad of schools, but particular schools that were majority, schools that had populations of students of color received notices that there was lead in the drinking water in their respective schools. Now, a key thing to note, which is really important as we start to think about this through the lens of environmental justice, and unfortunately through the lens of environmental racism, in Ward 8, which is a historically Black community or area within the district, there's an elementary school where parents had been complaining about discoloration in the water in their student schools, have been raising the issue with government officials, with elected officials. However, it wasn't until there was another complaints surrounding water quality from a area that is very affluent. Due to gentrification, the area used to be historically Black and brown, but is now majority white. As folks were pushed out of that community, it wasn't until the school in this particular neighborhood that local elected officials and government agencies began to respond. I think it's important to give that anecdote because we see these same sorts of crises occur not just in DC, but in Black and brown communities throughout the country. And so what we did with Black Millennials for Flint, we were very transparent and helped to advocate, of course, for all children, but more so empower the communities in both Ward 7, which is also historically Black community in DC, along with Ward 8, to push back on elected officials and call for action. And so as you can see here to the right, it was a pretty long journey, but definitely well worth it. So the first thing that we were able to do was to demand a public hearing, which allowed an opportunity for people from the community who had previously been ignored to be able to amplify their voices surrounding issues that were specific to their respective communities. But it also allows space for experts, so like pediatricians, to come in, as well as other members of elected officials. So like school board representatives were also present in that hearing, which is powerful as it relates to holding the decision makers accountable. And so while I won't go into extreme detail with this timeline, but we do see that it took a little over a year in order to get this bill passed. What's really important with the process with this bill is that we pushed really hard for the decision makers in DC, which would be DC Council, to allow space for inclusion. So from a community organizing perspective, we were able to incorporate more progressive aspects into this bill, such as equitable language accessibility. We were also able to incorporate more nuanced specificity around filters that are being used, that they need to be changed out regularly. Like, part of the compliance and implementation will require some sort of inventory and monitoring of when filters needed to be replaced. It also included that the filters had to be ANSI, NSF certified, for example. So very specific aspects in this bill. The reason why I wanted to start with lessons learned here is because it's just a perfect example how even with platforms like we have today with the Children's Environmental Health Network, this myriad of expertise is vital when we think about coming together collaboratively to establish policy. It's important for there to be diversity, not just as it relates to race or ethnicity or gender, but there has to be diversity as it relates to areas of expertise. And it's very important to include parents in that process, because they're the experts for raising their babies and children. So a key thing, and you'll see this as a recurring trend as far as the things that we looked at. So looking at some staple strategies around lead prevention, and then taking a look at where, in this instance, DC fared. So out of each of the lessons learned that you'll see today, which will be DC, the state of Michigan, the state of Tennessee, as well as the state of Maryland, the DC bill off top is the strongest bill from each of the ones that we have worked intentionally with. So with this bill, there is an actual bill. There is a law that mandates for testing of lead in school drinking water. Connecting back to what Lindsay shared, in many instances, there is not a lot of teeth surrounding some of the rules and regulations that come from EPA and the lead and copper rule. But in DC, they took it a step further. As far as the actions of remediation, for the DC specific policy, the point of remediation is actually 5 parts per billion. So a really interesting point here. So there were a few outlier environmental organizations during this time that essentially wanted to completely throw this bill away, because we all know that there's no safe level of lead, period. We are all aware of that. However, and I'll just be completely transparent, it would still behoove us to put something in place where we are making an attempt to mitigate lead that exists in our schools' drinking water. That's first and foremost. And we believe that just completely throwing the bill out in an effort to reach that 0 parts per billion threshold was just not feasible, and it is not in the best interest of children. So it was really interesting to see those different perspectives, where some groups actually, and a small couple of groups, rallied together to actually try to get the mayor to veto this bill. So in addition to trying to advocate for policy to just exist in general, there was also these external entities that were in opposition to this bill, I would be remiss not to mention that the majority of these external groups were not people of color. And additionally, they did not have any type of connection. Their children did not attend DC public schools, which is very important from a policy perspective, which goes back to why it's so important for the people who are disproportionately impacted should at the most be at the forefront of conversations surrounding policy. Also with this DC bill, there is tremendous public transparency where if you were to go today to the DC website, and it's the Department of General Services, which actually houses this information. You can find data for several tests over a period of time for every single school, including charter schools within the district. Additionally, there is a similar database that exists for child care facilities. I'll be very transparent and say with child care facilities, as far as maintaining up-to-date data is a bit more tricky than it is for our traditional charter and K through 12 schools, just because you have some of the nuances that are very specific to family care centers, for example, where you have folks who are operating childcare out of their home. So that can get very murky and ambiguous. The next thing that we saw in this DC bill is that there actually was funding to support testing. Now in DC, there is some funding that addresses lead service line replacement. However, it's still a bit up in the air as it relates to actual replacement of fixtures and indoor plumbing in each respective school. So that's a bit of an overview for lessons learned in DC. If we can shift to the next slide, where we will talk about the great state of Maryland. So you'll see a trend here, and we would be remiss if we didn't think about how the occurrence of the Flint water crisis really just shook the entire nation to be more attentive to issues surrounding lead and water. So we see in 2017, legislation passed in the state of Maryland, initially making the mandate for testing in school drinking water. But one good thing about Maryland is that they were very attentive to the EJ community, where we were very steadfast and very vocal saying like, this is a great start, but definitely there was additional work that had to be done. So in 2018, we saw some additions, in 2019, we saw some additions or amendments to the existing bill, which required in statute there to be funding allocated to mediation to lead drinking water fixtures and the like in schools. We see that that language is a bit different as we look back at the Washington, D.C. example, where it does explicitly state plumbing. Additionally, there are other environmental aspects from a building perspective that are included in that allocation of funding. As we can see here, there was about $30 million allocated for 2 fiscal years that should have started last year in 2020 and 2021. And then we also see this threshold of remediation, similarly to DC, where the threshold is at 5 parts per billion, which is significantly more rigid than what exists within the current lead and copper rule. We see green checks across the board in the state of Maryland. I will say where the public and transparent data component could stand to be stronger from a state perspective, where you would have to go to each respective school individually to access data surrounding lead testing reports. Let's go to the next state which is my current state, the state of Tennessee. Oh boy. So Tennessee made an effort, thinking about the political landscape of Tennessee with being a southern state, to even have a bill mandating testing just in respect to other neighboring states is pretty progressive. And I say that loosely. So there is a bill that exists that mandates testing in school drinking water. However, there is quite a lot of work that needs to be done with that bill. The biggest issue is, one, child care facilities are not explicitly included in this bill as it currently exists, and the threshold is way too high for remediation, which is at 20 parts per billion. However, we have a Black Girl Magic State Rep, London Lamar, who actually submitted a amendment, or introduced an amendment to the current bill in 2020. But when COVID happened, things took a back burner, and then it was actually reintroduced again. But this go round, there was a significant amount of hesitation and pushback from LEAs because the bill was not funded, and from the Republican Party. One specifically from the Republican Party is because of the threshold, where, of course, if we're now lowering the threshold for remediation, there will be more schools that will be identified as having elevated lead levels. And then quickly going to the next slide, going to the state of Michigan. This is super sad. So in the state of Michigan, there are currently no mandatory statutes or state laws that require testing for lead in schools, and K through 12 schools or childcare facilities. However, out of the phenomenal city of Flint, the former state representative, who is now the mayor of Flint, Sheldon Neely, did introduce a bill. It received no traction, which is so unbelievable considering what happened with the Flint water crisis. Currently, as of February of this year, the bill has been reintroduced by the current state representative, Cynthia Neely, and Black Millennials for Flint is working very diligently to provide support to ensure that the bill is strong and that it still maintains momentum. And then I'll leave with this last slide that kind of captures some of the very specific things that we learned that is necessary if we truly want to get to a place where we have lead-free drinking water in schools. So, of course, the lead and copper rule has to have stronger teeth as it relates to universal implementation. Also, I think that those states with existing laws should be incentivized. So there should be more recurring grant funding that's not necessarily competitive, that relieves the arduous process of applying for that grant, should be extended. Additionally, there has got to be more accountability and oversight as it relates to local and municipal water companies and providers, which Lindsay mentioned in her segment as well. Part of the pushback from school districts is there's not balance of accountability as it relates to the water provider. They can do all that they can to repair water fixtures and indoor plumbing, but if there are still lead service lines that exist within the perimeter of the school, the issue still won't be resolved. Definitely needs to be improvements as it relates to data republic and public transparency. We just simply don't know enough where all of the lead sources exist within schools. This can be solved with just an algorithm like what is used to identify or locate lead service pipelines. There has to be more diligence to ensure that there is clean and accurate data. Also, there are implications from a community health perspective. So really quick example, in Memphis and Shelby County, once there was testing for that first year in 2019, 2020, the Shelby County Board of Commissioners and the mayor of Shelby County actually authorized emergency funding to allocate or to allow for additional testing for students that attended schools that had elevated lead levels in their school drinking water. Additionally, there has to be more research allocated to funding to examine the implications or potential connections between childhood lead poisoning and the increase in services for special education programming. And then lastly, it's really important for this new administration to be more explicit about how infrastructure is inclusive of schools, specifically around drinking water and infrastructure. And then I'll leave with this. It's extremely important for there to be federal funding and investments into all of the organizations that are presented today to continue to educate our community, educate our educators, as well as our parents surrounding childhood lead prevention. And I will stop there.
Thank you so much for giving us some very helpful oversights as usual, and some of those specific case examples on the ground, which is just what we're looking for. Thank you so much. And our final speaker, just before we open up into Q&A, and we do have a couple questions starting to come in. Again, please do note your questions in the Q&A box. Carolyn, please.
Great, thank you so much. I just want to say how nice it is to be here today and to learn from the other speakers as well. What I'd like to do is start by giving you a little background on Elevate. We're a nonprofit organization headquartered in Chicago. And what we do is we design and implement energy efficiency and healthy housing programs. And we have long worked with residents in the community on addressing lead hazards in the home, like lead-based paint. And then for the past 4 years, we have been working a lot with the child care community to address lead in drinking water. And what I want to do is give you a brief overview of our work in the lead in drinking water space with child care providers, because I think it's really important for you to have that context. Because a little later on, we're going to share some lessons learned from providers actually trying to comply with lead testing requirements. So here in Illinois, Elevate really got started addressing lead in drinking water. We actually worked with EDF on a pilot project in Chicago, where we helped childcare facilities identify whether they had a lead service line connected to their facility, remove that lead service line if it was in place. We also helped them test their drinking water for lead and then implement mitigation actions if lead was found. And what we did is we took the learnings from that pilot project and actually began hosting bilingual lead and water safety workshops for childcare providers in the state of Illinois, where we provide them education on how to test their drinking water for lead and how to kind of understand and implement mitigation actions. Actually, the lovely childcare providers that you see smiling on the screen, these are some of the participants that we had at one of our lead and water workshops a few years ago. In 2019, we launched a lead and water resource program for childcare providers, where we provided them with grants to cover their lead and water testing costs, and also provided them with free access to short-term mitigation tools like water pitchers and faucet mount filters that are certified to reduce lead in drinking water. And then that brings us to today. Just this year, we launched a free statewide lead and water testing and education program for all licensed childcare providers in the state. So that's just a little bit of context on the work that we've done with the childcare community. And if we go to the next slide, I do want to kind of step back as well and provide you with a little bit of context on the lead and water testing requirements in Illinois. For those of you who aren't familiar, Illinois is only about one of a dozen states that currently has lead and water testing requirements for childcare facilities. And in Illinois, all licensed facilities, whether it's home or facility-based, they do have to test all of their drinking and cooking water sources for lead if they are in a home or building that was constructed before or on January 1st of 2000. So that's kind of the lay of the land. and Illinois. Providers, they do need to post their test results in their facilities so that parents can see and be notified of the test results. And they do also have to share their results with what's called DCFS, that's the Department of Children and Family Services. And if providers find lead at 2.01 parts per billion or above, they do have to implement immediate actions to provide children with a safe drinking water supply. And then they do need to develop a long-term mitigation plan to reduce the lead levels below that action threshold of 2.01 parts per billion. And again, they're having to share that mitigation plan with parents and their DCFS licensing representative as well. And then another key component of Illinois' requirements is that after the mitigation actions are implemented, providers do need to retest their water to ensure the lead levels come down below that action threshold of 2.01 parts per billion. And so, the new Illinois testing requirements, they establish some very important actions for childcare providers to take to address lead in drinking water. However, I will say when these requirements came out, there weren't a lot of technical guidance and financial resources to help providers comply with these requirements. And so what I want to do at this point is, if we kind of flip to the next slide, I do want to share some of the early challenges we did notice the childcare community kind of really grappling with in those early days to comply with the lead testing requirements in the state of Illinois. And I think it's so important that any state who's having testing requirements share some of the lessons that you're learning, because I think it's going to help set every state and community up for success so they can implement more robust kind of resources and guidance for those who will be responsible for implementing standards. At its most basic level, when these requirements came out, we spent a lot of time talking with childcare providers in person at these workshops that we were hosting. And we did, speak to providers, and they were having difficulty, understanding the testing protocol and kind of what I need to do, how I need to implement this in my facility. And then they also were having challenges, what lab do I select? Who do I contact to get the supplies to process my samples? So that was kind of, the first thing that we noticed. From there, at the workshops, providers brought in their test results, and they were really having some challenges, comprehending what their test results meant. Lab reports were coming from different labs and a lot of different formats, most of which can be challenging for the average person to understand if you've never seen anything like this before. So we spent a lot of time, hours after the workshops, meeting with providers on a one-on-one basis, helping them understand, okay, this outlet is above the action level. You're going to have to implement mitigation actions. So, really being able to interpret and understand what those lab results mean is very important for the childcare community. The next challenge we noticed is if providers did find lead in their drinking water, again, they really needed that guidance and support on what mitigation actions make sense for the results that they were seeing. So that was some of the additional support we noticed childcare providers needing. We also noticed a lot of language barriers for non-English speaking providers in our state. We were lucky in that we were able to offer bilingual workshops and materials to help make this testing and mitigation process easier for the providers that we were working with. But it is a challenge when not all of these resources and materials are translated into other languages to really support uptick from everyone in the state on these requirements. Some of the other challenges we noticed, I would frequently have childcare providers come up to me and tell me, very transparent, I'm really concerned if I do find lead in my water. How am I going to share this with parents? What's the messaging that I tell parents if I do find lead in our drinking water? Finally, not having financial resources early on in the process to pay for testing and to implement mitigation actions, it can be a real challenge for providers who don't have those financial resources in place. So those were some of the early challenges that we noticed in Illinois. If we go to the next slide, I am really excited to say that Illinois now has a free statewide lead testing program that helps with many of the challenges we noticed in the childcare community. And, Elevate was also really happy to partner with organizations like EDF and Illinois Action for Children to get resources in communities as well. But we have some really, important lessons and tips that we really encourage everyone to keep in mind if you do, undergo lead testing and mitigation in your state. And it's important to keep this in mind as well with some of the changes that may be coming with the lead and copper rule. One of the things that I really think is so important for anyone to do is to speak with providers and schools before any requirements go into place. You really need to have a conversation about what these requirements may be, see what concerns that they are, and what additional support may be needed. These groups and providers, they care so much about the health and safety of the children in their care, and they can be such a powerful partner on these lead testing efforts. So reach out to them as soon as you can. Ask them what concerns and questions they have, because they really can be such a powerful advocate for you, and they care so much about this. In addition to reaching out to schools and providers, really encourage people to think about partnering with childcare advocacy groups about testing efforts. We work here in Illinois with a group called Illinois Action for Children on all of our marketing efforts. So they're a statewide childcare resource and advocacy organization that has a lot of trust with the childcare community and has connected us to so many resources and opportunities for hosting workshops and reaching out to the childcare community. Another suggestion that we learned is really think about, who is going to be responsible for implementing the requirements, what state agencies, water utilities, school administrators are responsible, and make sure they're all coordinated and communicating so they all have consistent messaging going out to schools and childcare providers. Providers and schools may be overwhelmed by some of these testing requirements that comes out, and it helps so much if you can have consistent and coordinated messaging coming from agencies that are working on these requirements. The next tip I would kind of encourage you to keep in mind is the importance of robust training on testing requirements, what to do if lead is found, resources to assist with mitigation, and what appropriate mitigation strategies are. And also, if you can provide a contact for individualized support, this is so important. Our new statewide testing program does have a call center, which we found to be really helpful for providers. Another thing that I think is really important about Illinois' rules is that we do have an action level, and there are requirements to retest to ensure that mitigation actions are effective. And I think this is really helpful because it gives clarity to providers on when they need to act. And it's also ensuring that they're checking in on the efficacy of their mitigation actions. So I think that's a really nice piece. The next important kind of lesson or tip to consider is, do you have resources to help cover the costs of testing, retesting, and mitigation? If these resources aren't in place, it can lead to inequities, and maybe only the facilities that can afford to implement mitigation actions will be able to do so. So that's something that's really important to keep in place and in mind. And then finally, really encourage providing guidance in multiple languages to meet the needs of your community. And then also strongly encourage providing guidance, support, and templates for communicating results and mitigation actions with parents. Providers really need, assistance on this front. So that's something that's super important. And then finally, if we flip to the next slide, I just want to end by saying that Illinois has really made significant progress from some of those early challenges that we encountered. Today, in 2021, Illinois launched a statewide lead and water testing program that's free for all licensed childcare providers. It's called Lead Care Illinois. You can actually check it out at leadcareillinois.org. And what the program does, again, free lead and water testing, retesting, provides lead and water trainings and individualized support through that call center on understanding test results and education on mitigation actions. So we're really happy that progress is being made, but also we're still learning lessons as we go through this. And of course, the more we can do to provide financial resources for mitigation will also help this effort. So I will end there, but just really encourage questions later on. So thank you.
Thank you so much. Again, if I know you're listening, a lot of synergies here between the K through 12 environment as well as the early learning environments, a lot of similarities as far as what some of the needs are, where some of the gaps are, and certainly a few unique aspects. At this time, I just want to mention that if you weren't aware, the Children's Environmental Health Network a few years back, before the COVID pandemic, did hold a convening in DC, multi-day convening with a facilitator and all that, with some K through 12 and some early learning professionals exclusively to discuss lead prevention in these learning environments. And it was quite a surprise to myself and our colleagues at the table, the Healthy Schools Network and the Learning Disabilities Association of America, that this was the first real attempt that they had had, an ability that they had had to really focus in exclusively on lead exposures in their environments, and more importantly, what the related priority actions and needs and gaps were for them. We're going to put that resource link in the chat if it's at all helpful, but it's very high level as far as the report that came out of that meeting. But I believe it's useful for all of us as we continue these very important, not just discussions, but really try to work within our public health infrastructures and our localities to ensure that children are protected in the places where they spend the most time, like the environments we're talking about today. All right, so we're going to move into Q&A, and we have some great ones coming in. I'll start with a few of those, and one is for Lindsay. Have you considered, and this is from Hannah, have you considered recommending a filter-first approach for early childcare centers and schools in lead and copper rule revisions rather than relying on just testing, which is limited as it is just a snapshot in time and does not take into consideration fluctuations in lead in drinking water, even from a single source due to changes in pH, temperature, disturbance, stagnant water, etc.?
Yeah, thanks, Hannah. That's a great question. I think there are sort of pros and cons to the filter first approach, which is the concept of essentially just establishing or installing filters and forgoing the testing process entirely. And I think some of the benefits of that, we know filters are very effective. They're NSF certified to remove lead. They're very effective. It's relatively low cost compared to replacing a lead service line, for example, or even fixtures. So I think there are some real practical benefits. I'd say some of the drawbacks, you have to replace the filters on a routine basis, which could be challenging to do at such a broad scale. I know just as a case study in Chicago, I've been hearing on the ground challenges with actually getting replacement filters for the pitchers that the city have provided. So there's those logistical challenges. I also think that, at the end of the day, we want to get the lead out. And so not remove, installing filters is a really effective health protective strategy, but it doesn't get us closer to actually removing the lead source. I think one other thing I'd throw out there is, in the case of there being a lead service line, I 100%, especially in childcare, always recommend installing a filter if there's a lead service line present, because it does, it's an expensive endeavor to replace it. It can be a big source of exposure, and we want to make sure to protect the children. So that's sort of a little bit of a mixed answer, because I don't think there is a perfect solution here. And I think one other thing I'll mention with testing, because I agree there are a lot of challenges, as Hannah has mentioned, but there is there's no replacement, I'd say, for the experience of actually seeing a high lead level, an actual test, in order to galvanize action. And I can speak to that from my own personal experience at having a high lead level in Washington, DC a few years back, and, immediately, trying to address the issue. Even though I work in this space, it wasn't until I saw that level that I was like, oh, I need to do something about this. So I'll stop there and see if anybody else has thoughts on this question.
Thank you, Lindsay. Anyone else like to respond to this point?
This is Caroline. I just want to add to what Lindsay was saying, or actually just stress some of the points that she had. I completely agree, on the filter aspect. They're really important, but I just want to, stress how important it is to provide education and training for people who are using the filters, to really encourage them to replace those filters on a timely basis. So I think that's something that's super important to be paired with using filters. The other thing I want to stress that what I heard Lindsay saying is, if you do have a lead service line in place, the importance of using a filter. I 100% agree with that. And, hope we can do more to help people figure out if they are connected to a lead service line and to get a filter in place, in those situations. And then the final thing I just wanted to stress with what Lindsay said is 100%, understanding what the lead levels are in your facility or facilities across the state, I think is very eye-opening for people and really helps for action around this issue. So I do see a lot of benefits there.
Thank you. Thank you very much. A question for LaTricea. Due to fluctuations, in lead in drinking water and serious limitations in accurately sampling to confirm safety of drinking water source, do you see the 5 parts per billion standard as setting a precedent in conveying a false sense of security? And then how would you recommend better communicating test results to the public and educating them on the difference between the 5 parts per billion standard some states and DC are adopting versus the 1 parts per billion health-based threshold per the American Academy of Pediatrics standard?
Yeah, so that's an excellent question. And so let me take a step back further. So when we actually went to the initial hearing in DC in particular in 2016, one of the council persons who was the actual committee chair for environment did initially state that it would be at 1 parts per billion because there was a pediatrician that provided public comment during that hearing. So I kind of think it was the pressure was on in that moment. And so essentially what ended up happening is very similar to what you included in this question. So there was a little bit of reluctance as it relates to the actual manufacturing of the filters that they anticipated using, where yes, on the packaging, on the labeling, it says that it could assess down to, 1 parts per billion, for example, but it's not certain. So that literally is the rationale about why it was at 5 parts per billion. The other part of that is because of that fluctuation, just from a fiscal perspective, that would mean that retesting, a myriad of the various tasks that were associated with the implementation of the testing protocols would have to take place so frequently. And from a organizer and political advocacy perspective, we were just fearful that if we move forward, at least within that period of time, with still advocating for that 1 part per billion, they could potentially throw the bill out and say that it's not working. And so I would say that it's definitely a work in progress, where it's not sound enough. It does fluctuate. It's not 100% soundproof. But we're hoping that as time progresses and that with there being adequate assessment of implementation, at least from the technical perspective, with how well are the filters doing, hopefully, we can push to get closer and closer to that 1 part per billion. But that was the initial recommendation was 1 part per billion, but we just didn't have enough backing to get that to be reflected in that bill. I hope that answered that question.
Thank you. I think we all agree there is no safe level of lead And, you know, there are different, which can get confusing per the question. I think it's really well put. It can be extremely confusing for those of us in public health, and then those of us that are on the receiving end who are just trying to make decent decisions for their families and communities, right? Let us not forget, on the paint side of things, you know, we certainly have a public health action level that, in my humble opinion, is still not where we need to be. You know, we know that even at low doses, children can fare very poorly. So it's a continued work in progress. And I think hopefully all of us understand that, you know, we don't want any lead exposure, and we take all seriously, right? So there was a question also from Martha. I think, Carolyn, this is for you. It came in during your presentation, wondering if you have any information on whether the class you were talking about in Nevada would qualify for a child care registry guidelines, is at least how it's written, if that makes sense.
You know, I'm not up to speed on what's going on in Nevada. I apologize. But, you know, if anyone is ever interested in getting connected to kind of the lead safety training that we have in Illinois, I'm more than happy to connect people with kind of the online resource we have for that.
Thank you so much. Yep, anything you're able to drop in the chat, or we will have some follow-up emails coming as well, or at least one. And just for the last conversation, Hannah just mentions that she had a personal account, unfortunately, where her child was in a preschool classroom in DC. Lead levels tested for 2 parts per billion and was turned back on after mitigating twice in testing with a POU filter in place. So she's just stressing again that there's no safe lead level, and that the 5 parts per billion threshold is not protective enough. What might any of you recommend to a concerned parent like Hannah, in which she obviously represents many out there who are just as concerned?
And so I would say in this, definitely is not ideal. But at this particular point in time, I know a lot of times the alternative is to bring in bottled water, for example, but we have to be extremely careful with bottled water as well, as there are significant hazards that are associated with bottled water. The way in which it is evaluated and assessed is different. So I'll give you an example. So I still work for a school district, for example. While they test our schools, they don't necessarily test where the adults are. And so I literally bring like my own filtered water, where I have more control over that. Where if I have a like reusable bottle, I'm also taking into consideration that I'm not contributing to additional pollution. Again, I know that that's not ideal, but that is a consistent conundrum around the variability that exists with drinking water in general. So I think about even in the tap, like at my house, it's not 100% lead free, even if I use a filter. So I would say that there should be more investment on the technology side, where I mentioned about the manufacturing side, to get to more net zero type of filtering. I know that that's not like a right now solution, but it definitely is an area of growth as we think about the technical aspect of filtration.
Mm-hmm. Thank you. And also, just for anyone here, what do you all believe are the biggest challenges when it comes to any of these learning environments, and those professionals that are in these environments when they're working to try to address or be a part of this effort to reduce as much as possible and or eliminate lead exposures in their learning environments? So what can public health do to help? What can our professionals here in the audience do to help with the great work that you all are doing as far as complying to the lead and copper rule guidance right now?
I mean, I think, some of the biggest challenges we're seeing in Illinois, or saw especially early on, at least with complying with the Illinois standards, is, okay, here are my test results. What mitigation strategies make the most sense for the test results that I have? Because a first draw result means something different than what a hit on a 30-second flush result means. And what does it mean if all of my samples have lead? So there really needs to be some type of support mechanism in place to help guide facilities or schools or providers through how to interpret those results. And then ideally, that really needs to be paired with financial resources to implement the mitigation actions that are needed. So that's kind of where my mind goes based on the challenges that I've seen firsthand with childcare providers.
Thank you. And I would just add that we should not, even though lead has been probably the longest existing children's environmental health issue that we've known about, we have an abundance of science on, we don't need any new science. We know the major routes of exposures, but yet, and still, we're still dealing with it. It's still a challenge and still causing, forever brain development challenges and changes in our young children. So with that said, I think that there's still a huge need for basic education and just not making any gross assumptions. Again, just a couple years ago, the Children's Environmental Health Network, along with some of these other key partners, convened what we then found out to be the first ever time that these leaders, superintendent leaders, other educational leaders, school nurses, along with a variety of child care professional associations, they hadn't really ever had the space or the time or the invitation to have such a conversation. So clearly, and then COVID, right? And then all the other challenges that are happening. And we haven't even really had an opportunity in this webinar to really get into the realities of what these same learning environments are struggling and dealing with, right, during this year. And what are the ramifications of that and the children that they're serving, right? There's so many layers of this. But what we do not want in public health is for issues like this that are longstanding, still have to be completely addressed, to be pushed aside. We need to be doing them comprehensively, along with the mental health and all the other needs that have just been further exemplified in this last year. What about the equity implications of the lead and copper rule requirements for schools and childcare and public health? What should participants be aware of when it comes to what we should be on the lookout for, what we should be tracking? Any advice there?
Yeah, I can speak to a few things there and say, I think just with regards to the actual schools and childcare testing provisions of the lead and copper rule requirements and equity issues, I think Caroline already sort of hit on one, which is that not everyone has the ability, not all facilities have equal ability to actually remediate when lead sources are found. And so, that can be a huge equity issue. And I think that's why, it's critical that federal and state funding is directed in particular to facilities that are most, in need, most financially strapped. And of course, this, rule does not come with any funds, but we are in a moment in history where there's a real window of opportunity with, the American Jobs Plan, for example, from Biden, proposing $45 billion for lead service line replacement. Well, if we get that, that is enough and much more than enough to replace all the lead service lines in schools and childcare facilities. And it's important that, we then would prioritize those types of facilities if those funds are received. So number one for me is really the remediation costs. But two other things I'll flag really quickly. One is this concept of upon request. So, while all childcares and all elementary schools will be tested once, after that, it is upon request. And then for secondary schools and high schools, it's only upon request. And so there are elements of potential opportunities for inequities there, in that, wealthier facilities or those with more information access might make a disproportionate number of requests, or maybe more persistent in their requests, and could benefit more from the utility's support, especially if the utility is stretched thin across many facilities and with many requirements under the rule. And then the last thing that I'll flag on this point is just the prioritization, like where is testing done first? And there's some interesting language in the rule that recommends that EPA or recommends that water utilities consider factors like socioeconomic indicators, the age of students and whatnot when figuring out where to test first, but it's not actually required. So, the utilities can pick and choose however they see fit. And it is really best if they, take those factors into consideration when coming up with their sort of prioritization scheme for testing.
Thank you, Lindsay. That's all very critical, important information as we're all trying to weed through this. I also want to note that we've been hearing from the EPA directly that they have intent. Remember, this lead and copper rule, for those of you that understand, was officially, finalized literally in the last couple of weeks of the last administration. So now it's this administration's turn to take a look. And what we're hearing is that there will be some community comment periods, maybe some open hearings, maybe even some roundtables. So certainly as we learn more about those realities, we'll certainly let you all and the public health folks out there know how we can weigh in, how we can lean in, how we can ask these questions, how we can, list especially some of the challenges that we're hearing about implementing the current rule and to see where some of that may go. All right, well, I'm going to help wrap us up here. I really appreciate everyone's time. I first want to start with our, I think, amazing team at CEHN, Christy Truesdale, Hannah Gross, and Alyssa worked so hard to make this all happen, and we thank all of you for that. All of our panelists and participants, our panelists work so hard. We appreciate you. We need you out there. Looking forward to continue to partner and work together to leverage this important area of work for children. And EPA, I already talked about the listening sessions, and just remind you that our next town hall is May 18th. Is our third town hall in this series. So very much appreciate everyone's time and attention. And Christy, I'm not sure if there's anything else you'd like to add.
No, I think you did a great job. Thank you so much, everyone. This was another excellent installment in our series, and we look forward to everyone joining us for our third on May 18th.
Thank you so much.